Hello, everyone. Welcome back to Finding Your Path to Your Best Emotional and Physical Health. My name is Erin, and I'm here to bring you today's installment in our series of understanding the things that you need to do to change your weight and your eating behaviors. Again, if you like what you hear, don't be afraid to subscribe and hit the notifications, a little bell, so you can get more information as it comes out. Also, don't forget to download your free 5-part video series on the tips of finding the best physical and emotional health. And also, don't forget to share this with somebody that you think needs this information. So let's just get into today's topic. So today I wanted to talk to you briefly about taking control of your health by knowing your numbers. When you're trying to not only get healthy but lose weight, you have to understand your physical health in numbers and how that looks. And there's a number of things that we can do at home to help kind of take control of that and understand that. The very first one, of course, is going to be blood pressure. That's an easy one to do at home. You can use that to measure your overall health in general if you're looking to kind of lose weight, because typically the higher in weight we go, the higher in blood pressure we go. So as you lose weight, you should see your blood pressure go down. So in addition to losing inches and pounds, you can use that as an additional marker. Another one, which is near and dear to my heart that you can measure at home, is your blood glucose level. Now, this was the one that got me on my path to better health. So we have a family history of diabetes, and I began to worry about that as my weight started to creep up in my 40s, and I started to worry that something was going to happen and I was going to get that way like my grandmother did, and I didn't want to kind of go down that road. So I started monitoring my blood glucose, and you can easily buy a little $20 machine at the pharmacy or the grocery store and begin monitoring it in the morning to just kind of see what your fasting blood glucose is. So when it starts creeping up, and it doesn't have to be really, really high, your doctor is going to probably not be that worried about it, especially if your A1C isn't high. But if it's consistently above 100, like mine was, 110, 115, and that was pretty consistent in the morning, that's too high. It really needs to be between 70 and 90. So that kind of prompted me to say, I need to take control of my health, and then the weight came along with that. So when I started looking at my blood glucose and trying to figure out why I was developing this insulin resistance, which we'll talk about in a minute, how that contributes to weight gain and all kinds of things like that. So that was my first step in getting a better overall health and actually losing up to 30 pounds. So you got to kind of use that as a monitor for insulin resistance. The other things that we might want to monitor actually need to be done through lab tests by a doctor, and so those take a little bit more work. You have to coordinate with your primary care and try to get them to do the things to kind of monitor this, because sometimes our system does not allow for some of these lab tests unless you actually have a problem, which is ridiculous because we want to prevent things like diabetes and heart disease, not treat them when they're already too far gone. So we kind of wanted to monitor that. Now, one of the best predictors of weight gain is your fasting insulin levels. This is rarely tested for. You almost have to ask for it because they measure your blood glucose as the bigger issue regarding diabetes when they're trying to prevent that. But fasting insulin is actually the marker that tells you how resistant you are to the insulin, and it does not allow you to uptake the blood glucose from your blood into your muscles. So you actually want it to be less than 5.5. The reason you don't want to have an excessive amount of insulin is excessive insulin turns on fat storage and sugar storage. Now, I don't know about you, but I don't want any fat storage if I can avoid it. I want to use what I have and excrete what I don't need, right? store it a little bit for later in your liver, maybe that's okay. So you kind of want to figure out where that is, because when your insulin drops, like when you're fasting or something like that, and we'll talk about that as an option in a later video, you actually will turn on your fat burning and your sugar burning in your body. So if you're looking at people, or if you're already diabetic, you might have noticed that the more insulin they've given you to try to manage your blood glucose levels, the more weight you've gained. That's because the research is showing that insulin is what causes us to gain weight. So adding more insulin is probably not the best treatment method. That actually diet and lifestyle change and reducing insulin resistance is what we need to do. One of the things that we should kind of be aware of, just on a little side note, when we're looking at insulin levels, be cautious of medications that increase insulin levels. There's a few out there that are very well known for this and commonly prescribed. Gabapentin is one that's prescribed for nerve pain that raises your insulin levels. Olanzapine and quetiapine are two medications that are kind of used for head injuries, psychiatric disorders, and sleep. And those can also significantly raise your insulin levels. That doesn't mean you can't use them. It just means you have to kind of monitor for insulin resistance and increased insulin levels in general with your doctor. So just a quick note on some of other labs that kind of come out. You need to understand that labs within normal limits does not mean within optimal limits. The limits of a lab go from the very, very lowest end to the very, very highest end to encompass about 90% of the population. So 10% of the population will fall outside those two ranges. That doesn't mean they're in a good range for your optimal health. It just means you're within 90% of the population. You want to be more towards the mean or towards the average or slightly above average for most lab results. So without getting into a ton of statistics, those kinds of things are often overlooked. I always share a B12 example. B12 is one of those that ranges from something like the lowest labs are usually like in the 230s and the highest is over 1500. Well, you can have signs of B12 deficiency as low as 400. So that's within the normal range according to the lab results, but it's not necessarily healthy. And so we look for ranges a little bit higher than that. So back to some original labs that we need to kind of consider when we're looking at weight. Thyroid is another big one. And I often see thyroid stimulating hormone, or TSH, evaluated, and that typically in the optimal ranges is less than 2, but a lot of the times we'll see it higher than that. And then we don't see a follow-up where they're looking at the other thyroid hormones to see, is that thyroid stimulating hormone working the way it should? Because when you have these subtle inefficiencies in the thyroid, then it creates negative influences on our weight, and that's what we don't want. And sometimes those things are missed because, like I said, they're very, very subtle. So, when thyroid is not functioning, in addition to weight issues, we can see problems with our memory, problems with depression. So sometimes those things are overlooked quite a bit. An increase in thyroid stimulating hormone with a decrease in thyroxine means that there's some kind of underactive thyroid, which can cause weight gain. So another thing to encourage your physicians to look at and kind of help you monitor as a way to look at your overall health and weight. Another thing that we can use to kind of measure the effects of weight loss is lipid levels like cholesterol. So cholesterol levels, if they're really, really high, typically the doctors are going, well, let's give you a statin drug, and a statin drug will help change that or lower those if they can. But dietary changes will affect those levels far more than any drug will. And unfortunately, a lot of the statin drugs cause deficiencies in other vitamins and minerals that we're looking to avoid. So we kind of need to monitor that more as a marker of what our weight loss has done for us, as opposed to possibility of weight gain. Another thing that is very rarely monitored, but something worth looking at, especially if there's a history of childhood trauma and if there is a problem with chronic stress. Cortisol is a stress hormone that is very rarely measured, in our standard medical panels, but it is important to look at, and I'll talk about this off and on throughout numerous videos because it's the stress hormone. And when cortisol is activated, it helps us utilize sugars in our blood and help us mobilize those things in order to deal with the stressors or whatever's going on in our life, but they're designed to happen in a very short time span. So when we have long-term chronic psychological stress, we end up with problems where it increases actually the glucose and insulin in the body, and then, like I said earlier, we end up with some weight gain, and that's usually with long-term issues. So sometimes if there's a lot of stress, you can look for cortisol mismanagement. You typically through a lab test where you have to urinate on a little, like usually piece of paper, and it dries, and then they test it usually 4 hours, like every 2 hours over the course of like a day, because you want to see a certain spike in the morning. You want high cortisol in the morning, which helps you get ready for your day, and then a decrease after your day goes on. A few other things to take quick note of that I see very, very rarely monitored but are really important to our overall health is B12. Now, I'm always talking about B12, especially in terms of cognitive status. And as we get into some cognitive videos and cognitive decline, we'll talk more about that. But it is also essential to our weight and our metabolism. Because if you have low energy and poor B12 metabolism, you are going to want to eat more. It's natural. Your body is trying to get its oomph going and get going, but because you're not providing it with the right stuff, or it doesn't have the nutrients it needs to work properly. So it's going to ask you for things like sugar, because sugar will give you that bump. The other thing to look out for sometimes is vitamin D, because vitamin D is chronically low in this country. It's caused all kinds of issues, and it really hurts not only our immune system, but also our mood and stuff like that. So when you have a low mood, again, you tend to want to eat a little bit to give your body a oomph and get it going a little bit with that low energy and that low mood. So monitoring that is really, really important as well. And I guess, again, you want to look at what is within the normal range and then what is in the optimal range. And we'll talk more about optimal ranges as we go forth. So that's a brief summary of some of the things that you need to look out for to take control of your health and ask your primary care for. If you have any questions, please feel free to contact me and do some health coaching, and we'll be more than happy to help you find your best path to your ideal health. Thanks, and have a great day.